ABFM exam questions and answers with complete solutions 100% correct rated. A plus. Question: what is the short, term, and long term treatment for supraventricular tachycardia, SVT? A. AOA calcium channel blockers such as verapamil or diltiazem. Question: a 16-year-old girl has fatigue, takes oral contraceptives, has light menstrual periods, normal TSH, hemoglobin, and RBC count. Her MCV is less than 80. What lab should be ordered next? A. AOE, hemoglobin electrophoresis, used to evaluate fecunditines like beta thalassemia. Question: what are common signs and symptoms of ALS, amyotrophic lateral sclerosis? A. Heavy checkmark, progressive motor symptoms, such as asymmetric weakness, especially in legs, ankles, or feet, slurred speech, difficulty swallowing, shortness of breath, weight loss. Question: what is the most common cause of urge incontinence in older adults? A. Detrusor muscle overactivity, instability. 1/4. What diabetes medications are good for prevention of developing DM in pre-diabetes point? Answers: heavy checkmark, metformin. Alpha glucosidase inhibitors, acarbose. Orlistat, thiazolidinediones. Most specific sign of peritonsillar abscess. Answers: heavy checkmark, difficulty opening mouth. RX management for concussion. Answers: heavy checkmark, physical and cognitive rest. Avoid physical activity that exacerbate SX. Avoid activities that require concentration or attention, such as schoolwork and electronic use. Lung cancer screening recommendation. Answers: heavy checkmark annual. Low-dose non-contrast CT. Asymptomatic adults 55 to 80 years old who have a 30-pack years smoking history and currently smoke or have quit smoking within the past 15 years. Non-medical indicated elective induction of labor or C-section deliveries should be scheduled at what GA? Answers: heavy checkmark, 39 weeks, 0D. 2/4. Drug to prevent seizure and alcohol withdrawal. Answers: heavy checkmark, benzos. Initial RX, allergic rhinitis. Answers: heavy checkmark, intranasal steroids. Most effective medication to PR event relapse in alcohol abuse. Answers: heavy checkmark, naltrexone. Do not use acamprosate if renal disease. Which SSRI should be prevented in elderly? Answers: heavy checkmark, paroxetine. Anticholinergic effects. Screen for autism at what age in kids? Answers: heavy checkmark, 18, 24 months. Bacterial vaginosis has vagina pH. Answers: heavy checkmark, 4.5. 29 years, old woman. 30 weeks, gestation. Received DAP 3 years ago. What vaccine should she receive? Answers: heavy checkmark, DAP again. 27-36 weeks gestation, regardless of when they last received it. RX for acute gout. Point has HTN and CKD. Answers: heavy checkmark, prednisone. 3/4. Note: NSAIDs, colchicine, and steroids can be used for acute gout, but prednisone is best in CKD. MCC Med, induced adverse drug events in U.S. Answers: heavy checkmark, anti-coags. Most common risk factor for uncomplicated cystitis. Answers: heavy checkmark, frequent sexual intercourse. Others: spermicide use, previous UTI, new sex partner, FAM-HX UTI in first-degree female relative. First-line RX, primary dysmenorrhea. Answers: heavy checkmark, NSAIDs. Surveillance for Barrett's esophagus without dysphagia. Answers: heavy checkmark, endoscopy Q. 3 years. Best initial RX for keloid. Answers: heavy checkmark, intralesional corticosteroid injections. RX osteoporosis if 10 years risk of major osteoporotic fracture, ___%. Answers: heavy checkmark, 20%. Point with osteopenia. T2.5. Powered by TCPDF. www.tcpdf.org/4.